Because there's so much light behind her.
Yeah, I don't know, but this way they can know it's you're you, and I'm me.
Wait, we didn't show you. Oh. There you are.
We're discussing lighting.
Yeah, okay, good, yes. You get that okay?
So Jacquetta's being a production assistant.
Okay, I think this will be good.
That should be good.
Okay.
Should we turn that light on?
It is on.
No, that one over there. That way it shines a little towards her.
Well, we're 34 seconds. Yep, it's working perfect. We're 34 seconds
it is. We can see you really well.
See, I don't laugh at my presentation. We were trying to get some PowerPoint. Okay.
So I need to get just you and not the PowerPoint, right?
Well, kind of glance at the PowerPoint
okay.
so she'll know that I'm showing you the PowerPoint as well, too.
There. She knows you're showing us the PowerPoint.
So this presentation is about drug abuse in pregnancy. As stated, a baby's life shouldn't begin with detox. And the purpose of this presentation is to inform you about the dangers of women that use drugs when carrying an unborn child and the dangers that they are presenting to themselves and as well as the child. So when a female is pregnant, she's not just eating for two, she's actually drinking and breathing for two. So, according to the World Health Organization, cannabis is the most common illicit drugs used in pregnancy worldwide, followed by amphetamines type stimulants and opiates. In this presentation, I want to inform you about the drug abuse epidemic in pregnancy, different types of drug effects in pregnancy, and the legal consequences towards females that use drugs while pregnant. Illicit drug use during pregnancy is a major risk factor for maternal morbidity and neonatal complications. Although substance abuse during pregnancy may be increasing, it often remains undiagnosed or underdiagnosed. A self-reporting A self-reporting survey by the National Survey of Drug Use and Health from 2002 to 2003 estimated 4.3% of pregnant women aged 15 to 44 years old reported illicit drug use within the month prior to being questioned. Approximately 250,000 women in the United States, of whom 90% are childbearing age, meet criteria for intravenous drug abuse, which is not good. So, major consideration should be given to the implementation of routine antenatal education and counseling of any population identified as having an increased frequency of substance abuse. So, the most common illicit drug of abuse is cocaine, amphetamines, and marijuana. So I'm just going to go briefly and give a overview of those three drugs and just let you know the effects that they have towards the mother and the unborn child. Even though they give different effects, these drugs give the same results when it comes to the unborn child. So the first one is marijuana. Many marijuana smokers don't believe that there are health consequences for smoking marijuana, which can lead to many expectant mothers believing that, there's not going to be any type of side effects towards my child when, smoking marijuana. But the truth is, any substance a mother takes passes through her bloodstream and into her placenta. This includes THC, which is the active ingredient in marijuana. Just like cigarette smoke, THC and other toxins keeps your baby from getting the proper supply of oxygen needed to grow properly. Marijuana use during the pregnancy has been linked to miscarriage, premature birth, low birth rates, behavior problems, developmental delay, and learning problems later on in a child's life. The next one is cocaine. Cocaine abuse during pregnancy decreases blood flow to the fetus and can restrict oxygen to the baby, resulting in greater risk of premature and even stillborn deaths. During pregnancy, cocaine abuse can lead to premature detachment of the placenta, growth defects, and intestinal abnormalities. After birth, infants have a greater risk of sudden infant death syndrome called SIDS, hyperactivity, tremors, feeding problems, learning problems, and dependency and addiction to cocaine. Growth defects can include smaller than normal head size and defects of the kidney, brain, and even genital areas. Lastly, methamphetamine. Methamphetamine abuse, which includes crystal meth, ecstasy, and also speed, when used during pregnancy, increase the heart rate of the mother and also of the fetus. The fetus will be exposed to dangerously low levels of oxygen, which can result in low birth weight, premature labor, and even miscarriage. Babies can be also, like cocaine, addicted to methamphetamines when used during pregnancy, and will experience extreme withdrawal symptoms, again including tremors, sleep problems, muscle spasms, and feeding difficulties. They may also have learning difficulties later on in life as well too. So, if a person used drugs during their pregnancy, all hope is never lost. Women who stop taking drugs during the first trimester of their pregnancy increase the chances of having a healthy baby. But if you're taking drugs later in pregnancy, it's still important to know that you can still get help and to stop immediately. It's never too late to help your unborn child, and any steps to take so that you can have a normal life for your child. So according to ACOG, which is the American College of Obstetrics and Gynecologists, they have taken strong stand against using the criminal justice system to stop drug abuse in pregnant women. ACOG reports that some states are using the legal system in a punitive manner to force chemical-dependent pregnant women to seek treatment. So as of 2010, 15 states, drug abuse during pregnancy is treated as a form of child abuse. In 3 states, pregnant women who abuse drugs can be committed to mental health facilities or addictive treatment centers against their will. Only 19 states offer drug treatments specifically for pregnant women, and only 9 states offer priority admission to drug treatment programs for pregnant women. Now, in the state of Alaska, for some fun facts, I've learned that Alaska currently does not have any specific law or laws for convicting a woman for using drugs under pregnancy and convicting them as child abuse for a child. If a healthcare professional finds or has a suspicion that a woman is using drugs during pregnancy, the state doesn't require them to do any testing in Alaska, but they do require the healthcare workers to report any drug abuse during pregnancy to the state. So again, ACOG also states that threats of arrest, incarceration, or mandatory rehabilitation haven't reduced the risk of substance abuse during pregnancy. But they may discourage pregnant women from getting the prenatal care that they need to help the babies. So in conclusion, using drugs or drinking while pregnant can create serious health issues for both mother and child. Help is available for at-risk women who want to better themselves and their babies. And getting healthy for when you're pregnant means not only getting clean, but eating nutritional food, getting good prenatal care, and doing everything you can do to protect yourself and your child. Thank you.
Very good.
Well done.
Yay! Very educational.